Hello, my name is Stuart Scattergood and I'm an advanced physiotherapy practitioner working for the Midlands Partnership Foundation Trust within a musculoskeletal service. Our service predominantly gets its referrals from a GP source, however, other parts of the multidisciplinary team can refer into us. So we'll get referrals from occupational therapists, from nurse practitioners, from community podiatrists, any patient who really a clinician feels requires a musculoskeletal input. We'll see anything from the neck down to the feet, and within our service we have a different variety of clinicians. So we'll have students, we have newly qualified Band 5 physiotherapists, and then we work our way up to the extended scope practitioners. Additionally to that, we have other clinical areas that add to our service. So we have GP with specialist interest, we have a consultant rheumatologist, we have a extended scope practitioner podiatrist. We also then have a chronic pain management service that will look at patients who are suffering from more long-term pain and offer a more holistic approach. It's really important that the communication between these services is smooth. We're able to talk to each other, we're able to help each other. So we don't always need to refer to a clinician to get the best advice or treatment. We can sometimes just talk to them. If a patient we feel requires other input from a different service, we then have the ability to refer on. So we can refer into secondary care for a consultant's opinion or off to orthotics to get an orthotics opinion. We have the ability to refer into injection therapy services like ours. And the idea is to try and keep people as smooth as possible without having to bounce them between services. It's a really exciting time to get into physiotherapy. At the moment, within my profession, we're looking at advancing to a first contact practitioner. This is where a patient will not have to see a GP or a medic prior to being referred in. Their first contact will be the physiotherapist. That's not traditionally what's done, so it's a little bit scary as time goes on that patients are now coming into us and we're the first people they see. However, it shows the value of our profession and the way that the NHS England is currently looking at advancing our practice. On top of that, it's a very strange time going on with COVID-19, with huge changes going to the way that we work. Most of my consultations at the moment have been done over a Skype call, and we're using telephone calls, we're using emails between patients and ourselves. We had to really change the way we've worked. It's amazing how much of a success it's been, and I think that's just a credit to the way that physiotherapists are always able to adapt and advance, and so many patients have actually asked us to continue this after COVID-19. A lot of what's developed is likely to continue long term. Physiotherapy is a profession that is always willing to change. It's always willing to question itself and advance practice to see what is the best way of working. We're never likely to stand still. It's one of the most exciting things about our profession. With you guys coming into it, there's going to be a huge amount of job opportunities that are going to be created from the first contact practitioner role. I'm excited for you guys to get involved. I wish you all the luck with your interviews, and I hope at some point we'll see each other in clinic. Thank you. Bye.